Hello everyone, welcome to this audio podcast, and this this audio podcast aligned to a Storm Robotics production. This is the scientist with a Blittztorm with the Blittztorm Intermission, and this intermission or this audio podcast will look at leadership and management and what should it mean in pathology. So to begin with, some background in around this. So laboratory medicine is dynamic and challenging, thus requiring interactivity and inspiring role models, leaders and managers. In today's ever changing and demanding healthcare environment, identifying and developing scientists, leaders and managers is perhaps one of the greatest challenges faced by the scientific healthcare profession. The concept of leadership and management is complex and multi-dimensional phenomenon. Research conducted over a century concludes that although both concepts are involved through everyday practices. Everyday practices in ever advancing disciplines surrounding and across pathology, the accepted definitions or theories are not integrated between scientific practice and healthcare research. Integrative practice in the sciences, respectively or retrospectively, have been either sidelined and or non-priority owing to the volume of tests and investigations that enter pathology departments. So the objectives of this was to highlight what leadership and management should mean in pathology, and additionally to highlight some context, highlights some aspects in and around continuous professional development, or CPD. So in and around this, so knowing healthcare through research practices. So it was in early 2022 when the Institute of Biomedical Sciences, or IBMS, launched an update surrounding a corporate strategy, and wherein part of the update included a mission to commission academic research into the advantages that scientific workforce contributes to healthcare and science. In addition, with professional affiliated bodies, the Institute of Biomedical Sciences informed that it would seek to promote common areas of research through commissioning joint efforts. Historically, however, the nature of scientific practices across pathology has required and needed scientists who are keen to immerse beyond standard operating procedures and apply evidence-based practices, linking research, knowing laboratory practices, and so knowing laboratory practices is to also apply and link the evidence. This way of working, work-based developing is still to be encouraged, since routine scientific practices retrospectively, whether sort of knowingly or unknowingly, do not openly encourage healthcare through research practices. This is important to appreciate because the nature of scientific practices help advance specific areas of practice within the profession, where routine scientific practices alone lead to inertia. So leadership in context of transfusion practices then. So where this work is concerned, or wider understanding and context of renal health in the general population is required in order to ensure that the best use of blood or blood products are provided to patients who have a long-standing condition, a long-term condition, or a chronic illness. But at the same time, being a leader in the profession also requires scientists to demonstrate integrity and have those important constructive communication communication with multidisciplinary colleagues, and doctors making transfusion requests, so that they know when it is safe or not safe to potentially transfuse patients, and more now so because of an ever aging and living longer population. There are some very adept scientists who have a lot of knowledge and understanding in sort of main areas of laboratory medicine, yet are one, either not offered opportunity to implement knowledge base, i.e., so for example, unable to demonstrate leadership quality, and or two, practice management, for example, experienced managers, or for example, where experienced managers not identifying leaders in areas of laboratory practice who demonstrate work ethic, again going beyond standard operating procedures and apply evidence-based practices linking research. And so there is still a need to appreciate what further aspects of care are required for patients with long-term conditions, long-standing conditions, and or chronic illnesses in the broader sense, and where it would be pertinent to highlight what specific practices would help transfusion care guidelines and for specific areas of laboratory medicine. Now, in context, in around stepping out of inertia, so having a good knowledge base linked with a good leadership and or management is important, because this also embraces shared decision processes, allowing scientists to be sort of more welcomed as healthcare collaborators. Leadership, and perhaps more so than management, is also known when and how patients may benefit with alternative treatments or treatment pathways, so there needs to be good examples in practice so colleagues can gain firsthand on what works well, irrespective of grade. Today, this is still an issue. For example, there are lower grade colleagues who have spent time in various areas of healthcare and learning how to practice, and learning how practice could be enhanced or better corroborated, yet experience can be undervalued in a large workforce. So what could be done better? So an evidence-based recommendation for change in practice could also include robust pathway to encourage and develop future scientists, leaders, and managers, thus bringing laboratory medicine and pathology more into the forefront. There needs to be an opportunity for scientists to train frontline health professionals, especially to fulfill blood component requests. One example might be where renal patients, for example, or patients who may be suspect or high risk for renal insufficiency. The idea ultimately is to ensure safe transfusion care or practice, and prompt the concept of evidence-based practices as part of routine pathology practices. Scientists should be equipped with skill base to have multidisciplinary discussions regarding and relating latest evidence in patient care, and there needs to be a step or process whereby scientists are part of more involved multidisciplinary team practices, or MDT practices. So and around this and around leadership and a science practice and evidence based healthcare example. So there is a continuous requirement to have leadership through laboratory medicine and pathology. Management alone does not allow a pathway in practice for scientists colleagues to follow. With a scientific premise, it has been over a decade, and regarding and related academic and healthcare practice, one initiative continues to highlight integrative practice in line and aligned with evidence-based. Founded in 2009, the Renal Patient Support Group, the RPSG, is an evidence-based support group for those suffering with chronic kidney disease, or CKD. The RPSG now has over 10,000 members and is partnered with the Kidney Disease and Renal Support Group, or KDARS Group for Kids, which was founded in 2014, which has close to or near 2,000 members internationally. So in summary, Scientists are needed who can contribute through MDT and implementing evidence-based practices, thus shifting the paradigm of leadership and management, wherein profession can achieve practice excellence through evidence-centered repertoires in line with routine scientific practices. Thank you for taking the time to listen in on this audio podcast. This has been an audio podcast aligned to the Blittztorm Intermission in and around leadership and management. What should it mean? Leadership and management. What should it mean in pathology? And once again, this has been another Storm Robotics production. Thank you.